Hi, Claudine Lewis, respiratory therapy student, and I'm going to go over some event initiation and checks with y'all. So, you have a gentleman coming into the emergency room. He's 65 years old. He's having a massive heart attack. The medics have called, and he's unconscious, and they've intubated him. And he's 6'2", and we're going to set up our vent for his arrival. 81 kilograms. I'm gonna turn this on. It's gonna be loud. It's so angry all the time. We're gonna wait for it to come on. So we don't really know anything about him other than the fact that he had a heart attack. So we're gonna start off with the assumption that his lungs are not the issue. So 81. I don't know how much of this y'all can actually see. You can see a yellow button-ish. It's very hard to do this. SIMV. It's a volume. It'll work. I don't know what he's breathing, if he's breathing it all on his own. I don't know if the medics here have the ability to do rapid sequence intubation in the field. Don't think so. That'll work. Start. All right, so we're gonna go to our alarms. Apnea 15. Boop. High rate 35. Time line. Then a ventilation 11. 3. Peak airway pressure 40. That'll work. Up the O2 to 100. His heart needs some oxygen. Tidal volume is not 560. Too far. 600. Yeah, I know. I do not have a CO2 sensor on here. It's very upset about that. Frequency 12. Respiratory time. Let's go 1 second. That'll work. So I don't know the tower. Alright. Peep. I got a peep of 5, pressure support of 5. That'll work. Oh, I thought it was fixing to beep at me again. Got my limit set. Perfect. So after we get them all settled, everybody's done what they need to do. We're going to do a chest x-ray, make sure that ET tubes are where it's supposed to be. Listen here, make sure it's not leaking. If it is leaking, we're going to add a little air in the cuff. You can actually do that with this little duder by squeezing it. And then you have to let a little bit out. It's a little bit tricky. There we go. I got it in the green. Perfect. That's my patient's ET tube. Document the size of the ET tube. It's 7.5. Let's say it's 23 at the lip. There's a little number 23 there, and it's at the lip. Document that when you do a vent patient check, you're going to start generally I like to start with the patient because that's a good place to figure out if you need to change anything on the vent. So you're going to listen to breath sounds, see if they need any suctioning, see if they're too awake, maybe talk to the nurse about sedating them or unsedating them so you can start the weaning process, whatever you need to do. You're going to start by listening to their breath sounds, make sure they're about where they have been. Do they need suctioning? Do they need a breathing treatment? How's their heart rate? How's their blood pressure? Is their blood pressure super low? Are they really tachycardic? Is it because you've got too much pressure, too much volume? Do you need to change something to fix that? Or is it something unrelated, especially in the scenario where the guy had an MI? He might need dopamine or something like that to help his blood pressure. So you're going to document what mode you're on. Right now I'm in SIMV with pressure support and autoflow, which is just SIMV, just saying. And then, in other places you document like We're on 100% O2, tidal volume, what my settings are, which is down here. My alarm settings, which are over here. My high minute ventilation, my peak airway pressure, high tidal volume, my high rate, my apnea times 15 seconds. For some reason, it will not let me set a low rate. I assume it's because the apnea is only 15 seconds. High shoot CO2, low CO2. Tidal volume 600. Perfect. I'm getting exactly what I asked for. Let's do some breathing on this so I can show something. So I'm getting a really high tidal volume. If I can time the inspirations with when it gives a breath. And my minute ventilation just went through the roof. 14, 15. Not getting any readings for resistance or compliance. My high respiratory rates, alarms going off, my high minute ventilation going off. I'm just going to stop. Perfect. Just kind of want to see what alarms I could get to go off. All right. That will go away. Okay. I've acknowledged on my alarm, so it'll quit. So you're going to write down that you suctioned them, that you gave them a bronchodilator, that, you know, what the temperature was, which down here is my humidification area. And that's just in there, and then you have your temperature set, and it's usually right. If you have any other things that are being monitored, like intracranial pressure, all that kind of stuff, which we do not do at this facility, so I'm really not super comfortable with that information. Monitor that, do an arterial blood gas, usually a little bit after they get on the vent, like as soon as you can, as soon as everybody else has had the chance to do what they need to do. The ICU nurses like to get all their little ducks in a row, get the patient cleaned up, get the clothes off, put them in a hospital gown, get them positioned, and all that kind of stuff. And usually by then they've kind of mellowed out and gotten used to the ventilator, and you can see where you're at, and see if you maybe need to change anything as far as settings go. All right, thank you.